Or good morning, depending on what time it is for you. We hope you're well and safe in your homes. Thank you for joining us today. My name is Nisha, and I'm a product marketing manager here at AppViewX. Our topic for today is preventing cyber attacks and ensuring compliance in healthcare. This webinar will be presented by Alon Nachmany, Director of Customer Success at AppViewX. Just a little housekeeping before we begin. If you have any questions, please type them into the Q&A panel below the presentation screen. I will bring them up during the Q&A session at the end of the presentation. So let's dive right into the webinar. Over to you, Alon.
Hi, everybody, and welcome. Today we'll be talking about preventing cyber attacks and ensuring compliance in healthcare. On to our agenda. There we go. So today we'll be talking about why healthcare needs the tightest security. We'll be talking about the anatomy of a ransomware attack. We'll be talking about the repercussions of a ransomware attack. We'll be talking about preemptive protection strategies. We'll be talking about building risk-free IT and OT with AppViewX. And then if we have time, we'll have a questions and answers section. So why does healthcare need the tightest security? Let's talk about this for a second. You know, healthcare, we have thousands of electronic hospital records, or EHR, with sensitive patient data. We have the in-hospital medical devices and sensors that capture and process the vital signals. So that could be our heart rate monitors, that could be our EKGs, that could be our MRIs, all the different types of specialized machinery that we have for the healthcare industry. And of course, we have our remote patient monitoring through connected devices. That could be anywhere from telehealth to wearables that we have that some of our healthcare providers are coming out with, and some already have them out. You know, we have glucose monitors that people can wear. We have heart rate monitors that people can wear all the time. I've seen some pulse oxes that people can wear. You know, all of those things are connected. All those things are monitored. Some of them are monitored live. Let's talk for a second about ransomware. You know, ransomware is very big in our industry of information security, but specifically around healthcare. I think if everybody remembers, Hollywood General was really the first one, if you would, that kind of woke up the industry and spoke about what's going on and kind of gave us that awakening, like that shakiness of holy crap, what's going on around here. And if we think about it for a second, we have to remember that our industry is, you know, is a critical industry. I mean, you know, things can happen and we have lives literally in our hands. So we have to make sure that the information is available and ensure that the information isn't compromised. So not only do we need the information, but we need to ensure that it's not altered. So let's talk for a second here about the anatomy of a ransomware attack. So in most cases, we have a phishing attack where an unsuspected user downloads an email attachment and visits an infected site. That doesn't necessarily mean that you actually go to the website. That could be, you know, an attachment in a PDF. I had a client that, you know, their HR department received a resume, and in that PDF was embedded some code. That code reached out to that infected website and downloaded a Trojan horse that started to encrypt their files. Now, those files get encrypted, and then it spreads, and it usually spreads within your network from one PC to the next PC, eventually to your servers. Anybody who's mounting a drive, that's going to be considered a local drive, and that it's going to get encrypted directly from that machine. You know, eventually you're going to have a ransomware notice on your computer because it's not going to show you that notice until it already has encrypted. And they're going to tell you, hey, we want some Bitcoin. We want show us the money, if you would. And you're going to send the money, and you're going to hope that, you know, they're actually going to unlock it. In many cases, we've seen that that's not the case. Some mixed thoughts here, if you would. You know, a lot of people say that the hackers out there are actually more interested in sharing the keys, because the more they share the keys for you to unlock, the more people that are actually going to be willing to pay the ransom, because they see that there's that kind of trust that's being built. On the other hand, other people don't want to encourage the hackers to have these ransomware attacks. So given that, there's a lot of things here, and there are a lot of institutions that are paying, and given the fact that, like I said before, it's a critical industry, people's lives are at risk, we need access to those medical records, we need access to the billing, we need access to all of this information that's out there. The time that it may take to reverse engineer and reverse the encryption on the ransom, it might just make more sense to pay. So that's something to think about here. One thing to remember is that attackers are also targeting kind of the weak devices in our environments, our IoT devices as well. Let's talk about that for a second and just understand what those IoT devices are in a hospital. And like I said before, those could be our specialized devices. Those could be the medical devices, if you would. What happens if tomorrow morning our MRI machines are down in the hospital? That's not just a major health concern, but for a lot of hospitals, those machines are revenue-generating machines. That's a profit center for the hospital. There's huge implications to also the bottom line of the hospital. Those machines weren't really built around cybersecurity. Those machines were built to be able to give us the information. So we really need to think about how can we protect our IoT devices as well. And let's talk for a second about the repercussions of a ransomware attack. So speaking about it, we have our patient records, like we said before, that they either get stolen or they get held. What does that mean? I'll give you an example for myself. I received a letter about a week ago that my daughter's health information was compromised from her birth. Great. So now they know that she had a hearing exam and what her weight was at birth. No, not a big deal for my daughter, at least not at this time. Maybe when she's older, she'll get upset that people knew what her weight is. But really, for something like that, we might look at it and say, that's not a big deal, and we can move on. However, if we look at the Sherbet attack that happened recently in Israel, Sherbet, an insurance company, had a lot of health insurance information and a lot of procedures and other documentation around their customers. Great, same thing, okay, this person had a broken arm or this person had whatever kind of surgery. Again, not a big deal, but turns out that insurance company is the one that provides the medical insurance for government employees. And now that becomes an issue of potentially national security and other things. So a lot of people need to understand and need to think about not necessarily what is the information that we have in hand, but also what could this information mean in somebody else's hands, and not just what does it mean for me. Moving on, we also have to understand that there is some financial risk here. Having access to somebody's billing information, it could be their credit card, their banking information, their social security number. Some hospitals log their driver's licenses. I know some of my doctor's office use my driver's license number. Hey, if you have my driver's license number and you have my social and potentially my bank account number, you have the keys to the kingdom at the bank. So that's just something to remember. Even though that information may not look to the hospital as something critical, again, that information in the wrong hands could be something completely different. Of course, it could also mean shutting down information. It also means controlling devices. One of the other things that we're talking about when we're talking about IoT and OT could be a morphine drip. I had a personal experience. I had surgery about 2 years ago. All the machines that were controlling my medication were all connected over quote unquote secure Wi-Fi. What does that mean? Does that mean that I could be getting more of a drug, less of a drug, a certain mixture that could be lethal? Who knows what that could be used for? And again, in the wrong hands, and then the right person at the keyboard, that could change very quickly. So just thinking about that and kind of what we're doing here, we need to talk about paying the ransom versus retrieving the information, and of course, the HIPAA guidelines. What does that mean? What do I need to abide by? How do I abide by those HIPAA guidelines in order to ensure that my customers or my patients' information is actually secure? So just a few scary stats here, because everybody loves to scare everybody. Healthcare cyber attacks cost $1.4 million on average in recovery. Let's think about that. That's $1.4 million at recovery. Let's think about the probability of an attack. I think I read somewhere, oh, it's right here, 82% of healthcare organizations have experienced a cyber attack to their IoT devices. That's just on IoT. The 1.4, 82%. Think about that for a second when you're talking about budgets and what's it going to take to secure it, what's it going to take to pay it off. Balance that as you need to. Only 53% of device manufacturers conduct code reviews and continuous security checks. That's an alarming stat, especially in today's post-SolarWinds attack, because we all know that if SolarWinds was actually conducting a code review and a continuous security check on their code, they would have found the Trojan horse that was inserted there. So that's a huge stat right there to think about, 53%. I hope that number is going to change very, very soon, given what has just happened. Fortunately, I highly doubt it. Fewer than half of the device manufacturers, 49%, have security factored in during the design of the device. Like I said before, these devices are not built to be secure, and this isn't just in the healthcare industry. I mean, if we talk about OT in general, and I know I'm digressing for a second, but we need to understand that this is an industry that was built around availability, 100% availability. We cannot afford for heart rate machine to not measure the heart rate. We can't afford for an MRI machine to go down because of a misconfiguration on a security protocol. We've all seen it. We've all known that it happens. Just something to think about real quick. These are all afterthoughts, at least for 51% of the industry. UVM Medical Center, whose network got attacked last October, lost $1.5 million a day in revenue and extra expenses. The healthcare system expects the entire incident will cost them more than $63 million by the time it resolves itself next year. So just something to think about here. Again, when we talk about budgets, 1.5 million a day, 1.4 average for recovery, total of 63 million. 82 healthcare organizations have experienced some kind of a cyber attack. Think about these numbers, put them together into an equation, try to find out where your organization falls when you're putting together a budget. Should we be spending more money? Should we not? Should we employ new technologies? Let's talk about those technologies. So, preemptive protection strategies on the people side. We all know, we've all spoken about this. Apparently, the organization that had my daughter's health information didn't hear about this, but we do have multi-factor authentication. Multi-factor authentication is huge, especially right now. People, are people who are the accountants, who are doing billing, who are reading medical records, who are receiving something quickly, our doctors, our nurses. These aren't people who are trained in cybersecurity. They don't have that mindset. They're not going to see, an invite that says, "Oh, you have a new OneDrive file shared with you. Please enter your credentials for Office 365 here to receive it." Oh, wait a second, my organization uses OneDrive. Oh, this must be one of my patients sent, an ISO of their CT scan. Great, I need this. I was waiting for a file just like this. I'm not even going to check who it came from because it was probably shared by an imaging center who I've never heard of. Great, let me put in my credentials. Ta-da! Everything in my email is now exposed. Also, so are all of my contacts and any other information that I may have there. Multi-factor authentication stops those attacks 100% of the time because whoever it is will receive a text to their phone saying, "Here is your passcode. Please enter it." And they'll be like, "Hey, I never asked for a passcode. What's going on?" And probably the first time they won't get it, but by the second time they'll be contacting information security to see what's going on. So I cannot stress multi-factor authentication enough. That one is huge. We can also have an extensive email blacklist. So talk about this for a second. We all share information in the industry. There's several lists out there that are used by financials, healthcare, critical industries. I mean, you name it, there are lists for different domains that are out there and things like that. We definitely want to employ those. We definitely want to use those. Those are very easy. We can write a script that'll, run a cron job, update them on a regular basis, and be done with it. That's super, super easy to do. The third one is a strict password policy. I don't know how many people who are on this call have been to haveibeenpwned.com. Great website. I suggest you check it out. Not affiliated in any way. But that will tell you if your email address was part of an attack ever. And if it was, what information was compromised, such as a password. A strict password policy will allow you to ensure that your users will have a different password for every single system. And to keep that further is to have frequent password updates. What frequent password updates, along with a strict password policy, you'll be able to ensure that your users are constantly changing their password. So if somebody, they did give, they had the phishing attack, they did give the information, they gave the username, they gave the password, changing the password locks that person out. So yes, we'll be compromised, but at least we'll be able to stop the compromise there. Whether we knew about it or not is another discussion, and not something we, for today's topic, but at least that'll save you there. Next, we have our preemptive protection strategies on the machine side. So this one's a little more interesting, and I happen to think this one will help us as well. So we can first automate identity management. We can automate our keys and automate digital certificates for applications and devices. I'm going to read these all out and talk about all of them, and then we'll talk about each one in a whole afterwards. We can scan our on-site and remote devices and applications for real-time to proactively detect and patch vulnerabilities, standardize certificate auto-enrollment in IoT devices, have built-in policies for compliance, implement automated device and data backups, have an agile PKI that can automatically to scale and meet your demands. So really what we're talking about here is taking all of your strategy that doesn't touch people, automate it, lock it down, tie it down. It's something that we do a lot here at AppViewX. It's very easy for us to automate the identity management for the keys and the digital certificate. In fact, we can actually change those keys on a much tighter schedule. So if anything was compromised, it gets changed right. A, it gets changed right away if it was compromised. But B, it gets changed on a regular schedule, so you don't have to worry about the old keys. Where are they circulating? Where is it going? What's happening with it? On the second one, we can scan on-site and remote devices. We can actually see what's going on. What's going on in my network? Let's talk about that for a second, because I actually read recently about a hospital that had a Raspberry Pi plugged into a network port on their environment, running who knows what, maybe a web server, has a self-signed certificate. If you're using other self-signed certificates, your users aren't going to know the difference. They're going to think this is normal. Being able to scan and see what is serving with which certificate allows you to see what your users are seeing. So we can actually use that to identify rogue devices that may be in your environment. We can identify if somebody forgot to update a certificate. We can even automate replacing the certificate. So I think that's a huge thing there for us to look at what are we serving, not only the public, because that is incredibly important, but also what are we serving our users internally, so that we make sure that nobody internally is making the mistake of uploading something to a device that's going to get carried away in a few days. Also, standardized certificate auto-enrollment in IoT devices. That's also very big, especially as we're rolling out new devices. Old devices are getting shifted around. I mean, I don't have to tell people in healthcare, how quick things are moving from one department to another department. Hey, look at COVID. I need more ventilators in this department. We need to go buy new ventilators. I think I remember reading that Lamborghini was making ventilators. Everybody's doing whatever they can, and that's a great thing. I think that a lot of what we're seeing happening in the world is also a lot of people helping each other, whether it's through their companies, through their industry, or just people in general lending a helping hand. But what does that mean? We need to ensure that as these things are coming on, that they are secure, that they're serving their purpose, but in a secure manner, so that we don't put our patients at risk. So being able to have them auto-enroll for our IoT devices is very, very, very important. Our solution here at AppViewX, we can actually have a built-in policy for compliance. So we can actually write the policies and all of the automation around the compliance to make sure that we meet the compliance. What that means is that the next time you're sitting at the audit table, you can actually have your policies printed out. Here's what we do. Here, Mr. Auditor, here's how we do it. Here's what we do it. Here's the exact policy printed. This is from the system that runs it. This is how it's doing it. Thank you very much. Let me know if you have any questions. That makes things a lot easier, especially when it comes time for audit. We all know how long those audits can take. So that is something just to think about. And then obviously we can automate devices, we can implement automated devices and data backups, make sure that we have redundancies, make sure that we're safe, and that we have everything that we need. I have a talk talking about Agile PKI, mostly talking about how we can quickly shift from one to the other. If anybody read, there was recently the NSA released that everybody has to now change the certificate standards on their websites and basically depreciate anything that is no longer secure. Agile PKI lets you do that. So that is a big thing right there. And we're going to move on to our next one. Building risk-free IT and OT with AppViewX. I think I got a little bit ahead of myself, but that's okay. Let's talk for a second about our unique abilities here at AppViewX and what we can provide you. We have our centralized monitoring and visibility. Let's talk about that for a second. What that means is that even if you have the need for several different deployments of AppViewX, we can still make sure that we have a centralized monitoring and that central pane of glass, if you would, so that you can view it and you can make sure that you're looking at one thing for all of your PKI systems and even some automation. We can talk about IP subnet DNS scanning for PKI at the edge. This is what I spoke about before, where we can actually run a scan on your network, whether it's based on subnet, a list of IP address. Hey, give me a whole DNS name. I'll look up everything. And we can actually see what we're serving, again, whether it's our users internally, our users externally, and make sure that we're able to see what's out there, make sure it's secure, make sure it's all using the right CA. That's very, very, very important to make sure that we don't have any rogue devices. Let's talk about our built-in database that's in our solution. A lot of people look at that. There's two ways to look at that. One is a cost issue there. So by having our built-in database, we're not required to run an additional database. We're not going to take an SQL license from your SQL farm or anything like that. It doesn't need any additional care and feed. On the other side, it's also internal to us. We take care of it. We make sure that it's redundant and everything that's wonderful and great there. So by taking care of that, we make sure that it meets the compliance requirements and so on and so forth. Excuse me. We also have dedicated support for IoT, for DevOps, and for container PKI. Spoke about that a little bit before. And our pre and post validation systems for system workflows. So, we'll chat. We'll see what's going on before, give you a snapshot. That's with our scan that we spoke about before, our discovery process. We'll run whatever we need to run. We'll give you a report afterwards. Here's a comparison. That's great for when you need to go to management and say, hey, here's what we did. Here's what we looked at before. Here's how we look now. Just showing, if you would, the strategy behind it, the what did we do, how did we do it. Again, that's kind of our way to prove to management that we're doing what we need to do to stay secure. That's a great thing to show your board of directors also, just to help give them the warm and fuzzies. Some of our unique capabilities, a little more here. So we have our end-to-end certificate life management and automation. We have multi-platform support. We are CA agnostic. That's a huge one there. I'll show you, I think it's on the next slide, what our technologies that we can integrate is. It's a fairly large list. Compliant and HSM backed. So if you have an HSM and you want anything that you need to integrate, additionally, like I said before, we definitely always have our compliances in mind. So that's just something to think about. Vast built-in integrations and API supports. That's, again, that list that I'm going to show you now. All those integrations that we have with our list of, quite a long list of vendors that we can integrate with and have integrated with. Just makes things easier, if you would. If a vendor that you're working with is not on that list, it's not an issue at all. We can definitely write an integration for that and add another one to the list. Always happy to do that. Self-serviceable with service catalog. So what that means here is that you can, A, do the integrations yourself. We have a service catalog. I'm always here. My team is always here. We're always happy to help hold your hand anywhere that's needed. Should you want to do it on your own, it's not a problem at all. We can be completely self-serviceable. On the flip side, I also want to mention, even though it's not on the list here, on the self-service side, we can actually let your users completely be self-service. So what that means is, as a first stage, if your users need to get a certificate before it's completely automated, you can actually log into our system, get their certificates. We can integrate with a ticketing system. They can do it through a ticket, submit the ticket. That can talk to AppViewX through the API support. Get them the certificate from the CA, either deliver it back through the ticket or send it directly to the device, depending on how the integrations and how you want it. And then on our side, we also have 24/7 by 365 PKI support with true PKI experts, not some guy that doesn't really know what he's talking about. That's also very, very, very important. Just talking about that kind of difference there, we have the HSM, the PAM, and internal CA vault. We have our FIPS compliant encrypted database. We have our orchestration proxy. We have a highly scalable, distributed, and our modular. But just looking here at our technology partners and vendors that we've worked with in the past, I think this list speaks for itself on kind of what we can do and how we can do it. I'm going to move on. And why is AppViewX different? This is a great slide that I actually want to stop on and discuss for a second. So, we have next-gen architecture. We're running on containers. Containers very few years ago was a new concept. We're already running on it. If you have it, we can definitely integrate with what you have. Otherwise, we can just integrate on top and put our containers on top of whatever you're running, whether it be hardware, VMs, so on and so forth, cloud. But basically, we can be fully serverless hosting. Automation. We automate PKI operations using our low-code engine. That means that you can write it with very low code to make sure that it works. Of course, again, we're always happy to be here to hold your hand and help you. Core. So core is crypto orchestration, automation, and remediation. We actually have an all-inclusive solution and platform around that. Really, you can write it from start to finish, the entire system, all the way down to revocation. So if I'm switching CAs or if I have a CA that's compromised, that's something that we can do there. We are completely modular. So we can deploy, like I said above, in the cloud, on-prem, whatever you need, super simple upgrades and deployments. And we have our integrations, our out-of-the-box integrations with DevOps tools, cloud platforms, MDMs, EMM tools. We work with IoT devices. Again, that was that kind of list over there. And our scalability. Thanks to our lightweight architecture, we're able to scale our certificates and keys across multiple infrastructures to help work within your solution and what your solution looks like. That's a little bit about why AppViewX is different.